Grassley. Senator Toomey.
Thank you, Senator Wyden. Administrator Slavitt, thanks for joining us today. Just very briefly, I wanted to touch on one matter that is off the topic today, if I could, and follow up on the very brief exchange you and I had prior to the hearing, which is the work that we can do together to address part of the problem that is contributing to this appalling tragedy of opioid addiction and heroin addiction and deaths from overdose. I think everybody on this committee is painfully aware of this problem. I don't think a single one of us is from a state that's not affected by this. And fortunately, I think there are a number of things we can do to help address this. And the administration has consistently urged Congress to pass legislation that would give Medicare the same authority that Medicaid already has, that the private sector already uses, and I'm referring to the authority to lock in certain beneficiaries, lock them into a single prescriber and a single pharmacy when it is determined that they are likely to be getting excessive quantities of opioids and perhaps diverting these to untoward uses. I have a bill. Senator Brown is the lead Democrat on the bill. I want to thank Senator Casey and Portman from this committee who are also co-sponsors of this legislation. And it would do just this. It would simply extend to Medicare the power that Medicaid has. It would take a significant step, I think, in the direction of diminishing the risk of diversion. And I wanted to ask you if CMS and the administration fully supports this approach, and if you would support enacting this legislation as soon as practical.
Thank you, Senator, and thank you for your leadership on this very challenging issue. I know from work we've done with you in your office in Western Pennsylvania how personally involved you have been, and of course we are dealing with the effects of this every day as well. And we think that a lock-in proposal it makes every bit of sense in the world, and we completely agree that that's the kind of authority that would be very helpful in really taking a practical measure to stem abuse.
And if I remember correctly, the President's budget has actually called for this policy.
That's correct.
Is it your understanding that the President's upcoming budget is likely to renew that call?
That's what I would expect, yes.
Yeah, okay. Well, I want to thank my colleagues on this committee who have joined in this effort, and I'd really like to urge this committee to take up this legislation. It passed the House by a big bipartisan vote. It is bipartisan. It actually is scored to save money as opposed to cost taxpayer money, and it almost certainly would diminish the risk of addiction and death. So I really, frankly, can't think of too many higher priorities for this committee in the near term. I want to bring up a different topic, and that is the federal exchange. Administrator Slavitt, the fact is, since it was created, the federal exchange has lost money. Is that correct?
I'm sorry?
The federal exchange doesn't operate at a break-even. The user fees that are generated from the tax on the premiums are not sufficient to cover the costs. Is that correct?
Actually, there are certain costs that we're not permitted to cover with user fees because they're considered inherently governmental functions.
My understanding is that the legislation requires that the user fees cover the cost of operating the exchange, but that in fact the user fees are covering only something on the order of 40% of the costs.
So I think my clarification would be that user fees are intended to cover certain costs of the exchange, but not all of the costs of the exchange. And I can't give you an exact number, but I believe it's closer to 60% to 2/3 of the costs that get covered with user fees. But I will get back to you with a more precise number.
My understanding is that CMS officials have suggested that they believe that the user fees will fully cover the cost of the exchange by 2017. So if they're not permitted to cover the full cost of the exchange, why are we projecting that they will be?
So maybe it's a definitional item. There are costs that we have to operate the exchange that by law user fees aren't permitted to cover.
Okay.
So, but not counting those, maybe that's where your analysis is.
Well, I see I'm out of time, but I'd be very grateful if you'd follow up with an answer to basically this question. To what extent are the user fees appropriately designed so that they cover all of the expenses they're supposed to cover? Now, my understanding is that they are falling short, that the user fees are set at a level that is not adequate to cover those costs. But if you could clarify that, I would be appreciative.
We'll clarify that, Senator.
Thank you.
Well,
Thank you.
thank you, Senator. Senator Casey?
Thank you, Mr. Chairman. Administrator Slavitt, I appreciate you being here and appreciate your work, your public service. I would start by saying that I think Senator Toomey's right on two things. Number one, that this opioid problem is a matter of great urgency, number one, and number two, that there's a bipartisan consensus to confront the problem and deal and propose solutions. And I know this committee is prepared to do that.